Okay, good evening, everybody. I think we'll go ahead and get started. Uh, my name is Ian Macmillan. I am an Assistant Deputy Executive Officer in the Planning, Rule Development, and Implementation Division at South Coast AQMD. Thank you all for joining us this evening for a discussion about the air toxics health risk assessment for Bowman Plating. Want to appreciate the time everybody is taking out of their evening. I know that there's a lot happening in LA County right now with wildfires and with smoke. So we do appreciate that you all are taking some time here with us. We do have two meeting participation formats. So if we can go to the next slide. We have both Zoom, which you are on, and then we also have teleconference. Uh, both are available with language support in English and in Spanish. For those participating in the meeting via Zoom, it's really important that you click on the interpretation button at the bottom of your screen that looks like a globe. Then select the language of your choice, either English or Spanish. If you're on a mobile device, you might have to click the screen, kind of touch the screen first, so that the language option appears. You can also switch between the screens for the English language slides or the Spanish language slides, and you can select that at the top of your screen. If you wish to listen by telephone to the meeting in Spanish, please call 1-669-900-6833 and enter meeting ID number 963-4776-6450. And this information is on the screen for your convenience. If you're experiencing any technical difficulties, you may call us at 909-396-2311. And someone can help you out at that line. We will now, I hope, have an interpreter provide general meeting remarks in Spanish. And let's see if we can hopefully get this to work. Rocio, are you there?
Hola, buenas tardes. Can you hear me?
Sí. Yes, go ahead.
Awesome. Hola, tengan en, tengan en cuenta que también hay una línea telefónica disponible en español para esta reunión. El número de teléfono es el 1-669-900-6833. De nuevo, 1-669-900-6833, con el número de identificación de la reunión en español, número 963-4776-6450. Ofrecemos dos formatos para participar en la reunión: la aplicación web por Zoom y por teleconferencia. Los dos formatos están disponibles con soporte de idiomas en inglés y en español. Para asegurarse de que escuche esta reunión en el idioma correcto, todos, por favor, diríjanse a la parte inferior de la pantalla y hagan clic en el icono del globo con la etiqueta Interpretación. A partir de ahí deben seleccionar inglés o español. Si tienen alguna dificultad técnica, pueden comunicarse con nosotros al número telefónico 909-396-2311 para obtener ayuda. Thank you so much. Back to you.
Great. Thank you for that. Appreciate it. Can we go to the next slide? Right. So as a reminder, please silence your telephones to avoid any audio interference. After the brief presentation by South Coast AQMD staff, we will open it up for public comment. And please be aware that this video conference meeting is being recorded. By participating in this meeting hosted by South Coast AQMD, you agree to authorize recording of audio and visual content presented during this live event and consent to subsequent use of the recording in the public domain by South Coast AQMD. Next slide. We will have time after the presentation for public comments and questions. Please make your comments with courtesy, civility, and respect. Profanity and discriminatory comments are prohibited, and any violation of these rules can result in your mic being muted or you being dropped from the meeting. If you are in Zoom, next slide, please. Uh, if you are in Zoom, we should be on slide 5. Great. So sorry, you can click on the gray raise your hand button at the bottom of your screen if you wanted to comment, and it looks like a hand. If you're on the teleconference line, please dial *9 and you will be recognized in turn. Again, if you need technical assistance, please call 909-396-2311. Let's go to slide 6. You may also provide your public comment or ask questions via email or phone. If you would like to email your comments after the meeting, please email Victoria Mulvaney or Dr. Scott Epstein of South Coast AQMD. Their contact information is on the screen. I would like to actually introduce the key staff who've worked on this health risk assessment at South Coast AQMD. So I'm going to start with Dr. Epstein. If you could introduce yourself, and you'll hear from him a lot tonight. He's going to be presenting the information, but we'll start intros there.
Thanks, Ian. Hi, everyone. My name is Scott Epstein. I'm a planning and rules manager. I oversee the AB 2588 program and air quality assessment at South Coast.
Great. Going to move to Vicky. Can you introduce yourself?
Yes, hi. This is Victoria Mulvaney. I'm the program supervisor for the AB 2588 program, which oversees all the health risk assessment for facilities.
Great. Thanks. Alberto?
Hi, my name is Alberto Hasso in the AB 2588 group, senior engineer, and I'll pass it to my counterpart, Vanessa.
Hello, my name is Vanessa Tanik. I'm a senior staff specialist with the AB 2588 group, and I will pass it off to Matt.
Oh, we can't quite hear you, Matt. Shows you're off mute, but your audio is not working. I'm not going to ask you to do interpretive dance, but Matt Lee did a lot of the key work on this, so we'll get his audio working in case there's some questions that need to come back. Okay, so with that, I think we're going to go ahead and get on to the presentation itself. Again, really appreciate everybody taking the time tonight, and I'm going to turn it over now to Scott.
Thanks, Ian.
Great.
Okay, if we go to the next slide. Hi, everyone. Once again, as a reminder, if you're seeing the wrong language, you want to go up to the top of your screen and click the other tab. So it says the English screen or the Spanish screen. So the purpose of this meeting, the reason why we're all here today is we want to provide an overview of our AB 2588 Air Toxics Hotspots program, discuss the results of a health risk assessment that was conducted for the Bowman Plating Company in Compton, and then describe risk reduction measures that had already occurred at this facility. I have to go to the next slide, please. Okay, so here's an outline of the meeting. So we're going to provide some background information, then go into some more details of the AB 2588 process and health risk assessments, then talk about the results of the health risk assessment that was conducted, go through next steps, and then get feedback from everybody here. Next slide. Okay, so first, who is the South Coast AQMD? So we're a government agency. Our jurisdiction includes major portions of the 4-county area. We have roughly 17 million people in our jurisdiction, and we permit over 28,000 sources of air pollution. We're responsible for regulating air toxic emissions, and we're also tasked with meeting both state and federal air quality standards. Next slide. Okay, so here is a very high-level overview of the presentation that I'm about to give you. So these are kind of the main take-home points. So emissions from 2019 from Bowman Plating Company, so this is essentially all the air pollutants that come from this facility, were evaluated in a health risk assessment. And I have a few slides to kind of explain exactly what that means going forward. This health risk assessment evaluated both cancer and non-cancer health risks from Bowman's emissions of hexavalent chromium and nickel, And those emissions exceeded our thresholds in the surrounding community. And then as required by South Coast AQMD, Bowman then implemented several risk reduction measures to reduce those emissions and bring their health risks back below our thresholds. Next slide. Okay, so a bit of information about the facility. So Bowman is shown in this red boundary. It's located on 126th Street in Compton, and it performs a bunch of metal finishing processes such as anodizing, plating, spray coating, and this is mainly for the aerospace industry. Next slide. So this meeting and presentation is really focused on the AB 2588 program, the Air Toxics Hotspots program at South Coast, but there are several other programs and areas that address air toxics at South Coast, two of which I'm including here. So there was extensive rule development in between when the emissions were generated in 2019 and evaluated, and now. As this rule development was conducted as part of Rule 1469, and this rule was amended to address these specific types of emissions. So emissions of hexavalent chromium from metal plating facilities. There's also extensive efforts from our Compliance and Enforcement Division to ensure that Bowman facility is complying with all our rules and regulations, that's an ongoing work in ensuring compliance. Next slide, please. Okay, so what is AB 2588? So AB stands for Assembly Bill. So this is a state law that was enacted back in 1987, and it's a public right to know program. And the purpose of this program is to collect emissions data every 4 years to find facilities that could potentially have localized health impacts. So we look at many air toxics facilities all throughout our region. They're on a 4-year cycle. We don't do every facility every 4 years. It's sort of staggered, right? So we don't have all the facilities at once. And then when we identify facilities that could potentially have localized health impacts, we require those facilities to conduct health risk assessments to evaluate the potential health risks. We do a lot of vetting on these health risk assessments. OEHA, the Office of Environmental Health Hazard Assessment, also evaluates these health risk assessments to ensure that they are correct. If health risks exceed certain thresholds, we then do public notification or require risk reduction at the facility. So this Assembly Bill is locally implemented in our district through South Coast AQMD Rule 1402, and the requirements in our rule are actually more stringent than what is required under the state law. Next slide, please. Okay, so the AB 2588 process is sort of this stepwise process where the higher the risk, the more requirements. So basically, for most facilities that emit air toxics, we collect their toxics emissions data. We identify the facilities that could have localized impacts. For the facilities with higher impacts, we require this health risk assessment. If impacts are above the notification threshold, we require public notification. And then if they're above the risk reduction threshold, we require risk reduction through mitigation. Next slide, please. Okay, so let's talk a bit about what these health risk assessments are. So health risk assessments use computer modeling to take the emissions that are known from the facility and determine what the ambient concentrations or ambient levels of these pollutants would be around the facility. And if we know the ambient levels of these pollutants, we can calculate what the health risk is to the surrounding community. So the goal of these health risk assessments is to estimate the chance that a person may experience a health effect from these toxic air emissions. These health risk assessments are done based on a snapshot. So for this particular facility, this snapshot of emissions was conducted in 2019. So it takes a really long time to nail down what the emissions were at a facility. So we pick a year and then nail those down and then do the health risk assessment from those emissions. And the health risk assessments use generally conservative assumptions because we want to make sure that we're health protective for the most vulnerable members of the public, such as children, for example. Next slide, please.
Hey, really quick, Scott, I see that there's a question in the Q&A. It looks like it's a quick one to answer. Might as well pop in right here because it touches on one of the things you just asked about, asking, were the 2019 emissions used in this assessment self-reported modeled estimates or actually measured by AQMD monitors? And I know that there was some source testing involved with this. Do you want to just touch very briefly on this 29 emissions estimate?
Yeah, so actually both. So the emissions are reported from the facility. They're heavily vetted by South Coast AQMD staff. We actually audit those emissions. And a lot of the emission sources, or some of the emission sources, the main emission sources have been tested using source testing. So actually instruments measure how much emissions are coming out of the facility. Okay, so we should move on here. So, and if you're seeing the wrong language of your slides, once again, if you're on a computer, you can go up to the top of your screen and there should be a tab that you can switch the language. So it says presentation ENG screen, that's the English screen, and presentation ES screen is the Spanish screen. If you're on a mobile device, you may have to tap the screen and then you'll see that option at the top. Okay, so a health risk assessment reports risk, right? So like I said, it takes emissions, calculates air pollution levels in the community, and then from that, we can calculate risk. So we report two types of risk. So first is cancer risk. So that's reported as the probability of a cancer case in 1 million people. So chances of cancer per 1 million people. And this cancer risk estimation is done for both residents and workers. And I'm going to show some cancer risk numbers in a bit, but just to give you a sense of what the cancer risk is throughout the region. So if you look at all sources, not just this facility, all sources of air pollution throughout the region, the average cancer risk is about 450 chances in 1 million. We also look at non-cancer risk. So there are other health impacts that are not cancer, from breathing air toxic emissions. There's several types of non-cancer risk. So there's acute risk. So that's risk that occurs over being exposed to something in a short period of time, say over an hour. There's also chronic risk. So that's after being exposed over a long period of time, greater than a year. We also look at 8-hour chronic. So that's looking at 8-hour periods to sort of be representative of worker exposure. And these non-cancer risks are expressed in terms of what we call a hazard index. So these are well-established methods. So hazard index is pinned to a value of 1. So 1 is sort of the max level that we would not expect to see any sort of health impacts. So as you get higher and higher above 1, the likelihood of a health impact goes up. Next slide, please. Okay, so like I said before, we have thresholds in our AB 2588 program. So I want to talk a bit about them. So if a facility is below our threshold, so these are based on risk, these thresholds, they just proceed to the next quadrennial cycle. So we say, thank you. 4 years later, we do another, intensive evaluation of their emissions to ensure that they still remain below the thresholds. If their risks achieve notification level, we require public notification by the facility mails out public notices, and then we hold a meeting, which is where we are now. If the facility is in the action risk level, that means that risk reduction is required. We require risk reduction to bring those risks back below the action risk level. And then if they're up in this significant risk level, they're also required to do risk reduction, but it occurs at an accelerated timeline. Next slide, please. Okay, so what are the main sources of emissions at Bowman? So the primary sources of emissions are both anodizing and plating tanks. They do have some other equipment that does contribute to emissions. The main pollutants are hexavalent chromium and nickel. There can be other pollutants that come from these facilities, but these are the two air toxics that are driving the risk. The hexavalent chromium comes from fugitive emissions from the anodizing room tank. So that's sort of emissions that are not localized to a particular, stack. They kind of occur in a general area. And the nickel emissions come from a nickel tank. Next slide, please. Okay, so let's talk a bit about the health effects of these toxic air pollutants. So hexavalent chromium, after being exposed for long periods of time, can increase the risk of developing cancers such as lung cancer. Nickel can actually have some short-term health impacts, such as adverse effects on the immune system, and then also some long-term impacts, such as increasing the risk of developing cancer, such as immune system cancer. Next slide, please. So this facility has had a pretty long history in our AB 2588 program. So they underwent a public meeting and risk reduction based on a health risk assessment that was conducted in 2016 or finalized in 2016. After that health risk assessment, they were required to install ultra-low particulate air filters for some spray booths, which were installed in 2017. So like I said, we evaluate these facilities on a cycle every 4 years. We started a new cycle. While we were auditing their emissions, we identified some significant emissions from tanks that were previously unreported, at which we then notified Bowman to conduct another health risk assessment and prepare a risk reduction plan. So that's essentially outlining the measures that they're going to do to reduce the risk below our thresholds. While that health risk assessment and risk reduction plan were in the works, we amended our Rule 1469 that I mentioned earlier. This rule requires permanent total enclosures with ultra-low particulate air filters. So this is sort of the state-of-the-art, kind of the most stringent controls that could be implemented in a facility like this, where essentially all the emissions are captured in a negative pressure enclosure, and then those emissions go through emission control, filtration system to prevent the majority of them from going out into the community. Their health risk assessment was then conducted after that. This health risk assessment was based on 2019 emissions, which was before these emission controls were installed. These permits were issued in April of 2024. And based on the facility, we know that these risk reduction measures were implemented, and we have verified that. The South Coast AQMD approved their health risk assessment in November of 2024, and now we're here in January of 25. Next slide, please. Okay, so giving a little more details about the recent controls that have been installed at Bowman. So they installed these permanent total enclosures in the anodizing room and the plating room. Source tests have been conducted. So these are tests to actually measure the emissions coming from these emission control technologies. These source tests show roughly 95% control efficiency for hexavalent chromium. So they remove 95% of hexavalent chromium. And they're also effective in the plating room. So we estimate that the cancer risks near the facility have decreased by about 99% since the 2019 emissions were collected. And also the acute non-cancer risks by the facility were reduced by about 83% since those 2019 emissions. Next slide, please. Okay, so now we're going to show the results of the health risk assessment. And the most important thing about these results were calculated based on 2019 emissions before these pollution control measures were implemented. So this is a map showing the results of the computer modeling. So the Bowman facility is shown in red. We've identified on the map the areas where we see the maximum cancer risk for both residents. So that's shown as the orange circle, and workers as shown in the purple circle. We've also identified these two ovals, the green oval and the blue oval. So the green oval indicates the area at which we expect worker exposure exceeds 10 chances in a million. And then the blue oval is the area where we expect residential exposure to exceed 10 chances in a million. So everywhere within that blue oval, we expect cancer risks to exceed 10 chances in a million. Next slide, please. So if we look at the locations of those maximally impacted receptors, so those two small dots that were shown on that map, we can look at the cancer risk. And AB 2588, the thresholds and actions that are taken are based on the maximally exposed receptor. So that's why we're showing that here. So the residential cancer risk at that receptor, based on 2019 emissions, is roughly 673 chances in a million. For workers, it's roughly 44 chances in a million. And this does exceed our risk reduction and notification thresholds. Roughly 97% of the cancer risk is actually driven by hexavalent chromium. However, this is at the maximum receptor. However, risks do get reduced very quickly as you move out from the facility. So for example, at roughly 500 feet from the facility, the risks are actually 93% lower. Next slide, please. So the health risk assessment also looks at non-cancer acute risk. So these are non-cancer risks that occur based on short-term exposures. You can see the point of maximum impact is shown in orange right there. And then the blue curve or blue oval shows the area where the non-cancer acute risk exceeds our notification threshold of 1. Next slide, please. Okay, so when we look at that maximally exposed receptor, we see that the non-cancer acute risk is pretty close to 3. Nickel emissions are the main cause of this elevated non-cancer acute risk. And once again, this is based on emissions that were determined before the permanent total enclosure was installed back in 2019. Next slide, please. Okay, so what are the next steps for this facility? So Bowman must submit a risk reduction plan, which is due on March 6th. And the plan must evaluate how its current or any future controls that they're planning will ensure that health risks remain below our thresholds. And this needs to be demonstrated with computer modeling in their risk reduction plan. Next slide, please. Okay, so thanks a lot for listening. We have, we're really excited to hear, some feedback and answer any questions. But we also have some other methods where you can get in touch with us. So we have a lot of information on the AB 2588 website. We have all the documentation related to this facility. You can also email us at ab2588@aqmd.gov. We have a hotline. And we provided a QR code so that you can go right to the page on the website where we hold these documents. And I'll turn it back over to Ian.
Great. Thanks so much, Scott. Really appreciate it. We recognize this is a lot of really technical information, and so we want to open this up now. If there are any questions about any of this, that we can explain a little bit better, we're more than happy to do that. I do see that there's some questions that are being put into the Q&A box in the bottom here. So if anybody does want to make a comment or have a question, you can raise your hand, and that's the hand icon at the bottom of the screen. I'm going to go ahead and go to those who've raised their hands first, and then we can get to anything that's in the Q&A after that. I see a couple hands are raised. I'll call first on Fernando Ciordia. If you have a comment or question, please go ahead.
Can you hear me?
Yes.
I live right next door to Bowman Plating, and it just seems like at night I see the most smoke coming out of that smokestack that's on the very far east end of their facility. Does that say anything, or is that meaningful, or what are the chances of them being like not compliant with however much emission they're allowed to put out there, because in the daytime I don't see as much smoke. I see the most smoke at night, in the middle of the night.
Okay. Appreciate the question. I might ask some others here to weigh in. Maybe some of our engineers can weigh in. I think the first thing I'll take is the information that was presented by Scott it includes 24/7, 365. I mean, it's all emissions. It doesn't matter time of day or anything like that. That all is being incorporated so that the health risks that we were presenting show all of the emissions. But for some of the details about, which stacks that might be, I think, it's hard to say without really saying, okay, it's that specific stack. But I see, Jason, you came on camera. I don't know if you want to address any of this.
Sure, I can start to address it. Thank you for the question. My name is Jason Aspel. I'm a Deputy Executive Officer with the Engineering and Permitting Department at South Coast AQMD. First off, I'll start with, if you do have any concerns or complaints about sources of air pollution such as this, no matter what the time of day, you can always call in a complaint to 1-800-CUT-SMOG, and that does get dispatched to our inspectors to investigate that complaint. I will touch on that there are multiple sources at the facility.
May I say something about the complaint? Can you hear me? I'm sorry. I have called about the complaints, and they said that in order for them to do something about it, that 3 people must complain. That one person complaining is not going to do anything. They said I have to gather around 3 neighbors, and 3 people must complain in order for them to come out and do something about it, or at least investigate.
All right, thank you. We do have also staff from compliance. Let me answer the first question, and then I'll hand it over to Victor Yip. So typically the sources that were being addressed through this assessment don't have visible emissions through them. What the facility does have is multiple steam boilers that produce steam to provide heat to the tanks. Those plumes typically are visible at night, but that doesn't mean, it might not be another source that you could file a complaint with. Just want to say that's a common source of some visible emissions you could be seeing from a facility. But let me hand it over to colleague Victor Yip to address your other comment on complaint lines.
Hi, good evening. My name is Victor Yip. I'm the Assistant Deputy Executive Officer for the Compliance and Enforcement Division. So I oversee all the inspectors that are out in the field in your neighborhoods, responding to complaints, conducting inspections at these facilities. And so, Fernando, for your question regarding our complaint response, we do respond to every complaint. And I think what the inspector was referring to was for off-hour complaints, after-hour complaints. And so we do have an after-hours standby shift where we would deploy an inspector to respond, to conduct an inspection if we get 3 or more complaints about the same issue from different households. Now that's only our after hours response, because we're not a 24-hour immediate response type of agency. And so during the day, though, we do have inspectors that are responsible for the area, responsible for the facility. And as soon as we get that complaint, our inspector will, usually respond that same day. And so for an evening complaint, we do receive some additional complaints. We'll send somebody out right away. If not, we'll be there the next morning to take a look at the issue.
Yeah, but like I said, that defeats the purpose. It just seems like they put out more smoke at night under the cover of darkness.
Mm-hmm.
So if you were to go out in the daytime, they don't emit that much smoke. So what is the purpose of you guys coming out when there's less smoke being emitted as
Right.
to in real time when it's going on? So do you want me to wake up 2 neighbors, and then we're going to call, and then you'll come out there?
Well, usually when that's just our basic protocol. That's our standard protocol for evenings for the one-off type of complaints for facilities that we're not so aware of. And so for facilities that are on our radar that are in this type of program, let's say the 2588 program, I could, have my staff, deploy at night on one or two complaints. Just want to give a little bit of statistics here, though. In 2024, we only received one complaint the entire year. And in 2023, we only received two complaints. And so it does take a little bit of that partnership with the community to advise us of what's going on when this stuff is happening so that I could schedule my staff and have them ready to go set up if we do get these reports that this strange smoke is coming out of the stack at night, a certain time every night. So as Jason mentioned, we do encourage community members in your neighborhood to call in that 800 cut smog. They can file it online at www.aqmd.gov, and even now they can report the complaint directly from their phone using the phone app. So I'm not saying I'm expecting you to wake up your neighbors, but if the community does file these reports with me, and I start seeing that there's complaints about a certain issue at a certain time at night, I could definitely set something up for an evening operation.
You say you can definitely set something up, but will you set something up?
If I hear the complaints and I'm given the information about the time, what's going on, definitely I could set something up to have an inspector go out there in the evening.
I mean, the problem is the community is uneducated in this matter. I've been here over 40 years, and being uneducated in the topic, I've been naive about the whole matter, but I feel it's more of a problem than is being talked about.
Right. We do appreciate you coming forward to talking to us about it in this format. That's what these meetings are intended to get the word out, kind of understand the processes. And so we do really appreciate this interaction with you and letting me know about this evening smoke issue. And my inspectors are trained to identify whether this smoke, or if it's steam or water vapor coming out of the stack. They're trained to identify what that is, based on their experience, based on their inspector training, to view these stacks.
So you said to let you know. Do you have a direct number I can call you at night?
My number, the best way to do it is to file it through the 800 cut smog number. I do have a standby supervisor who monitors that line, and then that way the report gets filed, it gets tracked, and then we can start understanding trends. When we get these calls, we start compiling all this information, and we do understand the issues and the time of day, the time of night that these things are going on. So the best way to file these complaints is through our complaint line, because it all goes into.
What is your number so I could let you know next time?
Sure, I can give you my direct number, but again, I would encourage everybody to use our complaint hotline. And I can provide my desk line.
What is your number?
I'll put it in the chat if you'd like.
Yeah, your name and number, please.
I will put that in the chat. Thank you.
Okay. Really appreciate that, Fernando. It is helpful to have, someone who is there and seeing things happening all the time. So appreciate that, the feedback that you're providing there. I'm going to go ahead and move to the next hand that's raised. Dana Moore, I see you have your hand raised. Do you have any comments or questions for us? Are you there, Dana? We're not hearing you, but it looks like you're unmuted on our end.
Okay.
You
Hello.
There you are. Go ahead.
Okay, can you hear me?
Yes.
Okay, let me read my questions, and then whatever you guys catch on to, then I can listen to what you say. So my questions are, why are these emissions even allowed to exceed standard? And why are all these companies in minority areas? And how can we ensure our children aren't going to get sick in the future from these toxins? And I have a couple of more. And my other questions were, why are these testing periods so far away? People can be getting sick while these 4 years are passing. What can we do to protect ourselves from the toxins? And this is the last one. What do you suggest for the wildfires for us to protect our lungs right now?
Okay.
I know that's a lot.
That's a lot. I might ask you to
Look, I
repeat.
was writing it down while you during the
Yeah.
meeting.
No, those are all really good questions.
Thank you.
I'm going to try to get through them. I'm sure I'm going to forget something, so I'm going to ask you to help me out on repeating a question. So
Okay.
go to your first question, which was, I think you said, why are facilities allowed to exceed thresholds?
Yeah.
Right. So
Period.
good question. One of the things that this AB 2588 program, it can be confusing. One of the things that Scott described is that it's a series of sort of steps that if we do some investigation and then we find some information, we go to the next step. And then we find some more information that's, it sort of keep going up the next step as these thresholds are surpassed, just more information is needed, more action is needed from the facility, and we kind of keep going up these steps. And so these thresholds are designed that this is a very technical analysis. We try to go through it as quickly as we can. But you kind of do these screening steps. And so they get through the next screening level and the next screening level and the next screening level to determine, do they really need to take significant new actions? And so for this facility, we identify that yes, they are over the threshold for notification, that the risks were high in the past, above a level that we're notifying the public about this. And in fact, they also had to put on additional controls on their facility to make sure they stay below threshold, right? That they keep their risks below this threshold that all facilities are required to meet throughout the air district. So I'm answering sort of multiple questions here because it gets at, well, how do we make sure that kids are going to be protected in the future? It's these thresholds are designed to be protective for children and sensitive populations. And so, we've gone through the assessment and we make sure they stay below the threshold. They've put these controls in place, and we inspect regularly, and we test the emissions to make sure that the controls are doing what they're supposed to be doing. And they routinely report to us every 4 years how this program works. Every 4 years, they need to keep reporting to us a sort of a comprehensive report. But every year, they also are reporting hexavalent chromium to us because that is the risk driver. That's the pollutant of most concern. That's actually reported to us every year. But every 4 years, they go through a more comprehensive report. So we kind of have these whole series of nested analyses.
Okay.
So there's a lot to this. I'm kind of throwing a lot at you, but it's these thresholds are designed to kind of fit in with all of this to ensure that there's action. I think you asked a question also, and I see a similar question that you asked in the Q&A about this facility and why is it located where it is relative to.
Well, I see like they have this oil place. It's like, I don't know if it's in Torrance or Gardena, but it seemed like they put a lot of these companies in minority areas, I just want to know why.
Yeah, so it's a great question. It's understandable. The unfortunate answer that I have to give is that the South Coast AQMD, we are the air quality agency. We're charged with protecting air quality, but we are not a land use agency. We don't make any of those decisions. We're prohibited from making any decisions about land use. Does housing go here? Does commerce go there? Does industry go there?
Right.
That's a decision for the land use agencies, which are the counties and the cities. In this case, it would be Los Angeles County. They're the ones that make those decisions, and often these decisions have been made many, 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 many decades ago, and
Right.
those decisions persist until today. And that's just a common dynamic, unfortunately, but that's not really something that we're allowed by law to touch.
Okay. So you want to know the last two questions?
Yeah, go ahead
Um,
and repeat those, please.
Okay. So with all these toxins from these different companies, how can we as people like protect ourselves from like breathing these toxins? Like, do you guys recommend wearing masks or like eating a lot of fruits and vegetables to clean out your body? Like, what do you guys have any recommendations for people?
Yeah, that's a really good question. I would say for the general answer of course, live healthy. That's great. And I see Dr. Quick is on. I'm going to turn it over to her in just a second.
Okay.
But for, facilities like this, part of the challenge is that there are it's hard for the public to do anything to address emissions coming out of an industrial facility like this, which is part of the reason we have our rules and our regulations and our programs to put controls to make sure that the public is actually protected. Right. So that's part of all this program that we're walking through to make sure those protections are in place. As far as any personal exposure or anything like that, Dr. Quick, do you want to maybe introduce yourself really quick and then answer?
Yeah, good evening, everyone. My name is Nicole,
Bye.
health effects consultant here, and a couple thoughts I'll offer. Number one, really like your suggestion about, healthful living. That's always going to be a huge benefit for folks. Specific to this, as Ian mentioned, not asking for any individual community members to take action on this one. That's why these rules are in place, is to reduce this so that exposure is decreasing, which it already has in this case. A couple other thoughts, though, big picture. If you do have specific concerns about an exposure or any sort of symptoms, we always want folks to talk with their individual medical provider, get established, and sort of follow up. I know that you also asked a related question, just because we're air quality folks on here, related to wildfire smoke, which is very timely. And there are things that can be done on that. I'm just going to briefly answer. I'm going to hand it back over to Scott to kind of give some input on that as well. But there are things that individuals can do, staying informed on wildfire smoke impacts in your area, and individual precautions you can take to reduce that exposure, because that is a known health effect as well. So I'll let Scott jump in and I can answer any more too, but we want to point you to some useful resources on that one.
Thank you.
Thanks, Dr. Quick. So I think when it comes to wildfire smoke, the most important thing is to be aware when there is smoke in your area, or when there's windblown dust, for example, or really high levels of air pollution, just sort of typical day-to-day air pollution in your area. And the best way to do that is with the South Coast AQMD app or our website. So we have instruments all throughout the region. We monitor these routine air quality parameters. We call them criteria pollutants. That goes into this air quality map, and you can look at your particular location. What is the air quality at the current time? So if air quality is poor in your area, say from wildfire smoke, really the goal is to minimize the amount of smoke that you're breathing in. So some things like you want to minimize outdoor activity if you can. Keep your windows and doors closed. If you have air conditioning or an air purifier, that can be really effective at removing these pollution particles from your indoor environment. And then also avoid doing things that bring outdoor air inside. So like some people have swamp coolers or whole house fans. Like those aren't great, because that brings all that air pollution back inside the house. So really trying to stay inside and keep your indoor air as clean as you can go a long way at reducing health effects from wildfire smoke.
Okay, I appreciate you. Thank you.
Okay. Thank you, Dana. I'll also note that you had some questions in the Q&A that you typed in, and some of the resources that you can look to see what is the air quality, et cetera. We put some links in there and the answers to your questions. So feel free to go to there. For anybody, you can go and find those links for more information. I also noted in the Q&A, I think there was an earlier question about contact information. That contact information is in that Q&A box as well.
Okay.
All right. Thank you,
I
Dana.
appreciate you. Thank you.
Yeah, thank you for your questions.
Okay.
All right. I see we have another hand raised.
The hair
Kaya
quality.
Sugarman. I see you have your hand raised. Do you have a comment or question you'd like to make?
Yes, hello, thank you so much. Thank you for this presentation and important information. My name is Kaya Ellen Sugarman. I work at the organization Physicians for Social Responsibility, Los Angeles, PSR LA. And I understood based on one of the final slides that as a next step, Bowman Plating will be required to submit a future risk reduction plan, ensuring that human health risks remain below thresholds defined. And I heard that this must be demonstrated with computer modeling. So my first question is whether these risks are further confirmed with additional source testing and ambient air monitoring adjacent to the facility in addition to that computer modeling. And second question is because hexchrome emissions were and are such a huge issue, both from Bowman Plating, but also from other nearby metal plating and processing facilities in and around Compton and other parts of Southeast Los Angeles for many, many years undetected prior to the massive hexchrome monitoring effort by South Coast, which began after years of residents sharing concerns and complaints. Can you share more about what ongoing actual air monitoring or source testing efforts may take place to ensure Bowman does not backslide? Or for instance, in the case of potential for pollution control failure, can you please speak to what ongoing compliance testing will take place? Ideally funded by the responsible company, Bowman Plating, but performed by South Coast AQMD as the reliable regulator. Thank you.
Very good question, Kaya. A lot in there as we heard. So I think I'm going to ask for a little help on this one as well. But some of the things that we can say is that with the risk reduction plan, and Scott, correct me if I'm wrong, that is really to document to document the controls that are already in place, the source testing that's already been conducted, and to verify that with computer modeling that they are in fact staying below all of our thresholds, but to go through that final documentation analysis, even though the controls are already in, the source testing is already in, the permitting is already complete, but to make sure that that is all documented and that all the I's are dotted, the T's are crossed, et cetera. And if it turns out there is an I that's not dotted or a T that's not crossed, to make sure that additional action is taken to stay under our thresholds. So it's that final documentation procedure that's going to be done for that risk reduction plan. At this point, we don't have any plans to do further monitoring for hexavalent chrome or any monitoring for hexavalent chrome around this facility. We do have, source testing that's been done that's looking at emissions coming right out of the stack itself. There is continuous monitoring, I believe, that's done for the permanent total enclosure. And I see someone who knows more about this just came on camera. So I'm going to stop talking and turn it back over to Jason.
Thank you very much, Ian, and good evening, Kaya. Thank you for the question. So as part of our efforts with hexavalent chromium, as we've learned more about the sources of the emissions and also how to control them, we've amended two key rules, 1469, but also 1469.1. 1469 is for these open process tanks, these plating tanks, and then 1469 is for spray booths with chromate emissions. So through this time frame, we amended these rules and really locked down the control efficiencies on these. And in addition to monitoring the parameters, making sure the emissions are captured and vented to control. Because what we were finding is the control was working great. It was the fugitive emissions coming from these sources not being routed to the control entirely that were impacting nearby receptors. So now with these new rules, facilities are really required to monitor these regularly, twice a year for plating tanks and looking at spray booths. For monitoring, Ian did say there's no plans right now to do monitoring. Also want to refer you to, at the same time, there was an effort, the Community Air Toxic Initiative in Compton, that looked at these plating facilities in this area. There's lots of data, but again, the key to addressing all the emissions that were detected are the key provisions in these rules with regular testing and parameter monitoring. Wasn't sure if we hit all that, but feel free to ask anything or restate anything we missed.
Thank you, Jason and Ian. That's it for now. That's helpful.
Great. Thank you for your question. Okay, I'm looking now. I don't see any other hands raised here in Zoom. I think the questions that we have that are left here in the Q&A, I think we've gotten those already, answered those live. I see there was one question about asking about the slides in Spanish and English, and I think at this point we're probably past that, but there was a button on the top of the screen, but the slides are also available on our website. So I think you can get that there. I see, I'm sort of stretching it out a little bit in case there are more questions. I see another couple hands were raised. So let me go first. E. Martinez, I see your hand raised. Any comments or questions?
Hi there, can you hear me?
Yes, go ahead.
Hi, this is Erica Martinez with the Office of Supervisor Holly Mitchell, and I'm curious if AQMD can set up alerts for real-time information to be provided to communities when there are exceedances at this facility. Is that something that you have the capacity to do?
Maybe I'll take that one first, but if there's others here who want to add to it, feel free. I would say that we do have that for some kinds of facilities and some kinds of processes, and it can make sense in those instances where you would expect occasional high spikes, and that those high spikes could potentially impact the community on those short-term bases. For this facility, the risk really is more of a decades-long, exposures. It's cancer risk over a lifetime. And so individual excursions that, might be a little higher or a little lower, there's not a lot of meaningful sort of information that community can do anything with that. And you might expect some ups and downs, and it doesn't really affect, long-term health risk in that way. So I don't think that, setting up an alert system for this type of processes or this kind of facility, it doesn't quite fit here. Other kinds of facilities it might, but here it doesn't seem to fit.
Got it. I just thought there was some concern raised about the lag in time in terms of when the data becomes public. And then you're told, hey, you were exposed when there were these exceedances in the past. And so that might be helpful. But thank you for answering the question. I have another question. Is this facility in a designated green zone? And if so, what does that mean?
I don't know the answer to that question about it being in a designated green zone. I do know this is part of our AB 617 South LA community. And so, we, interface through, the staff involved with that and are available to provide information to that community. But as far as a green zone, that wouldn't be any AQMD designation.
Okay, so maybe we'll follow up with your office after this call. Thank you.
Sure. Okay, thanks. I see we have another hand up. Thamar Pena? I apologize if I'm mispronouncing names here.
Yes, hi, I'm Tamar Pena.
Yes.
And I have like a multifaceted question, and I realize that you may not have the answer for all of the parts, but I know that Bowman Plating is, well, you showed that it's on 126th between Muna and Alameda. And I know that there's a middle school on 124th. So part of my question is, how closely is the school administration able to communicate with your organization or your agency? like what's the protocol for when there is like a spike? I know that a lot of the data that you showed was for residents, but I didn't see much for like students or elementary and middle school students who spend time in the area outdoors. And the reason I'm asking about the school is that I have nieces who go to like who had the situation where they were in class and there was a very nasty smell, so they took them out of the classroom and didn't even notify parents. So like what communication has there been between the agency and school administrations as to what to do in cases of extreme pollution or acute pollution?
Yeah, a really good question. You're right. There's a number of elements here. I'll take part of it, then I'll ask Scott to help out on some of this as well. So first, with the school that just to the north, I think it's Bunch Middle School. There's another school that's actually in the notification area just a little bit to the southeast. That's a charter school. And just when how we characterize those facilities when looking at this, you mentioned, well, we look at the residences and, how are schools potentially different? And what we use is a state methodology for assessing health risk, because that state methodology does consider that children are not mini adults. I mean, in many ways, but their bodies react differently to pollutants, and there's potentially elevated risk for children that need to be considered. And we incorporate all of that, and we assume that there are these childhood exposures so that it is protective of schools, right? And whether it's an elementary school, middle school, high school, daycare, et cetera, we do consider these elevated risks in these methodologies so that we are being protective for all populations, including these sensitive populations like children. So that is included already. I don't know, Scott, can you touch on some of the outreach that occurred with the schools and for Bowman?
Sure. Yeah. So we met with the school district a few weeks ago, and they did provide notification to all the students and the students' parents in each of the schools about the health risk due to this facility. Much the same notification letter that was mailed out to the residents in that region.
And one thing we do, of course, encourage is that if there are any concerns about air quality, it doesn't mean that a resident has to call from their home. If a school administrator says, "Hey, there's some air quality concern that I have here," they can call 1-800-CUT-SMOG, and then they have that direct line to our inspectors, and can engage in that way too. If there are specific concerns, we have opened up that channel of communication with these specific schools. So if there are specific concerns, they can also reach out to us directly. They have the staff direct line as well.
Okay, thank you for that information. So the rest of my question is, you already mentioned that you are not a land use agency, but I do wonder if there is like a way that this agency is able to, I don't know if like take away the permission that the plant has, given that there are schools in the area, or if hopefully recycling plants or like this type of plant that affect air quality have to get permission from this agency. And then the agency makes sure that they only give permission if there's a certain distance from schools, at least if we're not if we're not able to protect residents that way, but at least from schools.
Yeah, really good question. I see Jason's on. I think he's probably going to touch on some of the requirements that we have related to permitting and schools. We do have some, different criteria that we consider, additional criteria when it comes to schools. We do engage with land use agencies when they are making land use decisions. They're, supposed to notify us and say, hey, we, for example, through the CEQA process, we're considering doing this kind of land use decision. Or schools also notify us, and we will comment and we'll provide guidance and, recommendations for land use. But it's ultimately those other agencies that have that authority. But when it comes to air quality, I don't know, Jason, if you want to talk a little bit about our permitting and how does that work, especially with schools?
Yeah, absolutely. Because the in between of these 2588 efforts we're talking about is permitting efforts, enforcement efforts by inspectors. But one, if a facility, this is an established facility with their permits, if they were to request to, say, install new equipment that either increase their risk or increase their emissions, first off, since they're within 1,000 feet of the school, that would trigger a public notice at the school that is required to go home to each of the parents of the students attending the school and all addresses within a quarter-mile of the facility. So the school will be informed, the parents will be informed as well as residents, and they'll be able to comment on it as well and learn more about the proposed project if we approve it. The other part about our rule for these chrome plating and anodizing shops is no new facility can go in near a school. And forgive me, I don't know the exact distance of that boundary, but that is something that we do prohibit. But again, this is an established facility with their permits. All the efforts they've been making recently, according to our rules, is to reduce emissions and reduce risk. But if that were to change over time, then we would be notifying the public because of how this particular shop is situated.
Okay, Tamara, did that answer your questions?
Yes, thank you very much. That was all.
Great, thank you for those. I see another hand raised. Francisco Lopez, did you have comments, questions?
Yes, hi, good evening. This is Francisco Lopez. I'm with County Supervisor Holly J. Mitchell's office. Thank you for hosting this webinar again tonight. There's been a lot of questions about land use and also just responsibilities from different agencies that you kind of uplifted. And I just want to ask if you could help elaborate some of these points. I think some of the details you shared in the last comment, I heard them as AQMD works on a specific portfolio. They don't touch anything else. It kind of sounded to me like you all work in a silo, which I know is not the case. Can you please elaborate what kind of role AQMD plays in this inter collaboration with the other agencies involved? Thank you.
Sure. Yeah, good question. For example, when it comes to land use decisions, the agencies, the cities, the counties, they'll notify us saying, hey, we're considering some land use decision. And they'll, have an analysis of that, and they'll reach out to agencies like ourselves and other agencies as well, and say, hey, do you have any comment? Do you have any guidance for us? Things that we should consider. If there are, things that we know, we can send in a comment letter. We can, arrange meetings. We can provide that feedback back to the land use agency, and then they will consider all of that and in their best judgment, move forward with what makes the most sense for each specific agency. Of course, that's when we're talking about land use decisions. That's sort of one part of this. When we're talking about this AB 2588 process, we've done some outreach as part of this process as well to various agencies, including the county, to let them know that this is going on, and to again, sort of provide that opening for dialogue about, what it is that we're doing. Is there information that we should be incorporating from the county's perspective? So it goes both ways. I think that we have this collaborative relationship with the different agencies. But I just kind of wanted to highlight there's some things that we do as an agency. There's some things that other agencies do that are in their purview. So I think that's what I was trying to cover. I hope I answered that question.
Thank you.
Yeah, thanks, Francisco. Okay, so I don't see any other hands raised right here. I'm looking at the Q&A, and let's see here. I think we covered those. There's a question here about the Q&A questions that I'm reading from right now. Are those going to be sent out? I think we could probably post those on our website where you can find all the rest of the Bowman information and the presentation and all that. We can supplement just a little file there. And then there's another question here. Do you guys have access to all the reports about oil company in Compton, like complaints and what you guys are doing about it? No creo que hayan contestado ninguna pregunta en concreto, solo la dirección, vuelta y no hubo algo aceptable. Okay. So let me take the first question here, asking about do we have access to all the reports about oil companies in Compton? We do have a lot of information about oil companies all throughout our jurisdiction. A lot of our information is on our website. AQMD has a database online called Find. So you can go to aqmd.gov/find, and you can find a lot of information about individual facilities there. I don't know if the person who's asking the question wants to raise your hand. You can ask more specifics there, and we can, find out what information you're looking for. But information about complaints, compliance history, emissions for some facilities, et cetera, are there. You can find permits online as well, and the permits show all of the requirements for each individual facility. So there is a lot of information that's out there right now, including about oil companies, et cetera. And as far as the second comment, I'm not sure if there's specific questions. If there's something that we're not clear on, more than happy to provide more clarity. So again, feel free to raise your hand. But that's why we're here. We want to provide the information that folks are looking for. But not seeing a hand raised right now. If there is any follow-up questions, if people go back and are thinking about something, there is the contact information we put in the slide deck. Feel free, please reach out to us. We're more than happy to follow up. But at this point, I'm not seeing any other hands raised. Don't see any other questions in the Q&A. See, just as I said that, one more came in the Q&A. Is there any programs or initiative that give back to the community to address pollution, like planting trees to help air quality? I would point to our AB 617 process. Again, this is one of the designated communities for the AB 617 Community Air Protection Program. And so there's a lot of information there. There's a lot of work that's going on, community emission reduction plans, including looking at things like green spaces, et cetera. We can provide a link in the Q&A for that. I'm hoping that someone can type that in for me. All else fails, you can go to aqmd.gov/AB617, look for the South LA community, and you'll find a lot of resources there. So, okay. So, happy to answer that question. Don't see any other hands raised. Again, thank you all for taking time out of your precious evening for this meeting. If you have any other questions, feel free to get a hold of us. Thank you all to staff for helping to answer these questions, everybody coming on here. With that, I think we're going to call it a night. Thank you all, and be safe out there. Good night.